So you have missed a period. And the first thing you did, naturally, was get a pregnancy test. But it's negative. Wait, missing period is the first sign of pregnancy. But if it's not that, where on earth has your period gone? Let's break down some of the possible reasons for missed or delayed period and explore what's happening inside your body. Hi, I'm Dr. Sumayya Alansari, a senior consultant homeopath at Olive Homeopathy, Malappuram, Kerala. Today we are going to discuss some of the possible reasons why you have missed or delayed periods, but the urine pregnancy test or UPT shows that you are not pregnant. First reason, you are in fact pregnant. It can happen that you're too early in your pregnancy, and this is why the HCG level in your blood is too low for the UPT to detect it. So what can you do? Wait for 1 more week and repeat the UPT. The chances are it will show positive. Second, ectopic pregnancy. It is a situation where you are in fact pregnant, but the pregnancy is not in uterus. Rather, it's elsewhere. It could be anywhere, fallopian tubes, abdominal cavity, or anywhere except the uterus. In such a scenario, the level of HCG produced in your body is not enough for the UPT to detect it. So if at all you have missed period, along with that you have symptoms like sharp abdominal pain which may persist, or it may be on and off, like it may come and go. There may be vaginal bleeding or dizziness. If at all there are symptoms like this along with the missed period and still the UPT is not showing positive, then it's time for you to seek medical help. So I recommend you to meet your gynecologist. And what if there is no pregnancy at all? There are certain causes which may cause missed or delayed periods, and this may range from lifestyle choices to full-fledged health issues. Moreover, during 2 transitory phases in a woman's life, it's entirely normal for her to experience irregular periods. First is the menarche or the beginning of menstruation, and the second is menopause or the end of menstruation. In both of these phases, it's normal, it's absolutely normal for the women to experience irregular periods. The average length of a menstrual cycle is 28 days. But anywhere between 25 days to 35 days is absolutely normal. So these are the possible reasons why your menstrual cycle is longer than normal. First, stress. Stress causes anxiety, and anxiety puts your body in fight or flight mode, which leads to the production of cortisol, and cortisol can actually disrupt your body's hormonal balance. And this disturbance in hormonal balance can lead to change in menstrual cycle. Can all kinds of stress cause you missed or delayed periods? No. A bit of stress is okay and your body can manage that. But prolonged stress or chronic stress or sudden and huge amount of stress at a time can actually trigger your hormonal imbalance. For example, if you lost a loved one, a divorce, or emotional shock, a sudden trauma, or facing accidents, such kind of situations can trigger the kind of stress which would lead to hormonal imbalances. Second, change in the sleep schedule. If you suddenly change your sleep schedule, it disturbs your circadian rhythm. Now, circadian rhythm is your body's internal clock that regulates the internal functions. So disturbances in your circadian rhythm can actually cause disturbance in your hormonal functions. If there is disturbance in circadian rhythm due to any particular reason, which may be also traveling to different time zones, I may like to add, can cause disturbance in the optimal hormonal functioning, which may lead to disturbance in the menstrual cycle. Third, sudden loss or gain of weight. If your body loses or gains 10% of your weight suddenly, then your body's functioning may be disturbed, and this may lead to hormonal imbalances. So gradual weight loss is okay, but suddenly losing weight, even 10% of your body's weight at a time, may disrupt your body's internal functionings and cause ovulation to stop for a month or so, and this may cause missed periods. Also, being underweight due to poor nutrition or any other underlying cause like anorexia or other metabolic diseases may also trigger hormonal imbalance. Fourth, intense exercise. Now moderate exercise is great and I always recommend it, but intense exercise, too much of exercise may cause decrease in relative levels of estrogen in your body. Estrogen is the female hormone that helps regulate the menstrual cycle, and if its level reduces, the menstrual cycle may get disturbed and thus ovulation may stop. So you see, so athletes or gymnasts, whenever they are engaged in vigorous exercises, may actually miss periods for up to 3 to 6 months, and that's completely normal. Fifth cause, PCOS. PCOS or polycystic ovarian syndrome can cause disruption in your hormonal balance due to the increase in the level of androgen in your body, and this may lead to hormonal imbalance. If you want to know more about PCOS, please check out my previous video. The link would be given on the screen. Sixth, thyroid dysfunction. Thyroid is a gland that secretes hormones which are responsible for body's metabolism. So whenever there is increase or decrease in the functioning of thyroid gland, that means whenever there is hyperthyroidism or hypothyroidism, the metabolism of the body gets disrupted, and this may eventually lead to disruption or disturbance in the hormonal balance, which would lead to disturbance of the menstrual cycle. So you may have missed period due to hyper or hypothyroidism. Seventh, medications. Certain kinds of medications may cause disturbance in your menstrual cycle, like for example antipsychotic drugs or contraceptive pills. Some kind of progesterone only pills or progestin pills may cause disturbance in the menstrual cycle. Even IUDs, the intrauterine devices that is inserted, may also cause delayed or missed periods in certain females. Eighth, early perimenopause. Menopause is the cessation of menses, the end of menses, which is normally seen by the age of 45 to 50. But whenever there is menopause, which is early, so you will see in certain ladies around the age of 40, they will start experiencing symptoms like menopause. So this is called as perimenopause. So whenever there is perimenopause and which is earlier, due to the reduction in the number of eggs, there is no more ovulation, or the ovulation becomes irregular, and due to this the menstrual cycle also becomes irregular. So the amount of hormones in their body, the number of menstrual cycles that they have, the number of menstrual periods that they have will eventually dwindle and become nil. So it's just menopause, only that it's a bit early. So that's early perimenopause. Early perimenopause would also be associated with symptoms of menopause like hot flashes, irritability, etc. If you want to know more about it, please comment in the comment section below. And for your personal concerns, you can reach out to me on the number given on the screen. You can WhatsApp me and I'll get back to you at the earliest. Hope you found this video helpful. If yes, please drop a like. Share it with your friends who needs to hear this. Stay aware, stay empowered. Thank you for watching. Have a happy periods.